Hey, Ryan Osmer here with Oz Coaching, and this is another, episode of these specialist series. And today I have the wonderful privilege to have Ashley Hiscock, who is a certified athletic therapist and also a colleague kin, and she is a co-owner of, maybe duck your head, Premier Athletic Therapy, just up off of Tops of the Road. So, wave hi. So today, I guess I wanted to just give Ashley the opportunity, because I think athletic therapy as a whole, I think some people may not necessarily understand or just realize truly what your scope of practice is and what you do, and that it's not necessarily just purely dealing with, say, athletes or anything like that, which I think a lot of people probably have thoughts on. But I want to just, I guess, on a first point is just kind of, in a nutshell, what do you do on a day, and what do you kind of cover, and what is athletic therapy?
Well, I'll start with what is athletic therapy, I guess, because like you said, most people aren't sure what it is. So we are specialists in orthopedic rehab or sports injury, so the muscles, bones, and joints. So if someone has an injury in those things, like, they've broken their arm, or they've sprained their ankle, or they've hurt their back, as long as it's orthopedic in nature, it's something that we can deal with. We do tend to see more of an athletic or active population, so it doesn't have to be athletes per se, but just, I guess, anyone who is interested should expect to be doing exercise, and that's a big part of the rehab. So, it's not necessarily athletes. We do see athletes, but you don't have to be one.
And the combination of, no doubt, the exercise and training, but of course hands-on stuff, right?
Yes, absolutely.
Right? So, taping and any manipulation, stuff like that?
Well, mobilization. We can't do manipulations.
Right?
Get into hot water with us. So we don't do
no, but that's okay. That's good to know. So I guess, what we talked about off camera, in terms of some of the really just common themes that she sees on a daily basis here in her clinic is, I think, she certainly deals with a lot of post-MVA clients. And like I said, certain experiences, people were really active, before that. But even if not, I think really the training strategies pretty well are still common ground across various, modes, right? And I think, you're a huge, obviously, believer and provider of functional training in terms of how someone can move, better move, restrict certain movements, posture, all that stuff. So I think for this purpose of this video is, what are just, I guess, some of the key movements, training, because we're going to do in a separate video, we're going to actually do a few demos and whatnot of things to consider to include within your, say, training regime. But just as an overview of how you kind of develop a program or training program or even rehab program, what are a couple of things that you just got to include on most training programs?
Sure. So I guess a big one for us is rowing. So most of us, I'm sitting terribly here in front of the camera, but in our, do you want to pause? Sorry.
That's okay. Don't worry about it. Don't worry about it. We'll just go on live, whatever. The clinic's not closed, okay? So we're just going to continue. Don't worry about it.
So I guess the big thing is, everything's in front of us. So those chest muscles get tight because most of us are working at a computer, or even if we're not at a computer, washing the dishes is in front of you, and holding a child is in front of you, being on your phone is in front of you. So those chest muscles get tight, the back muscles get weak because, those muscles are trying to hold onto your shoulder blades and keep them back.
Absolutely.
So just, we make sure we do a lot of rowing and pulling, so back work. I like to incorporate carries as well. So like farmer's carries, suitcase carries, those kinds of things. So it's challenging your whole body as a unit, but also promoting good posture.
Clearly,
If you do anything poorly, you can reinforce poor movements. But
and it's funny because I know there's clients that when you say, like, grab some weight to carry, and they're like, okay, if you leave a client alone, go grab some weight now to carry, and it'll probably be quite low, and most people's probably purses or the groceries, or obviously kids, depending on the size of your kid, it's dramatic, right? That people just think carries are, I guess, subconscious, in terms of, I'm fine to do it, but it's one thing to lift and have the strength to lift certain weights, but like you said, then it's the actual movement and technique, right?
For sure.
So no doubt you do off carries. as
yeah,
well.
Yeah, I'll do the off carries. I really like those actually, and it's really interesting because I'll explain it to people. You say like, the weight wants to drag you down, but you need to stay straight. But you can't overcorrect because that's what you see too. So you see people to lay the weight on their leg and lean away from it, which that's what our bodies are built to do. They're built to compensate.
Okay.
So if you've got a 30-pound kid,
yes,
I mean you're rarely carrying them front time.
Yeah.
I ask people, I'm like, do you have a child? Yes. How old are they? Tell me.
Yeah.
How much do they weigh? Oh, they weigh this much.
Yeah.
Do you ever carry them in the front? Nope.
No.
So, and everyone has a favorite hip,
a favorite way.
side.
Absolutely.
So it's just, balancing those things from your day-to-day life.
From your day-to-day life. And then from, I guess, understanding the core, we've talked about kind of more rows than pushing, and I'm a huge believer of 2 or maybe a 3-to-1 ratio. Again, depends on maybe the person's, right? Yeah. So that's good.
That's hard, though, to get through to people.
It is, I know, but it is, right? Especially guys, I want to do chest, right? I want to do that, right? So, but absolutely. So from maybe the hip dominant side, leg dominant side, is there specific, I guess, exercises or movements that you more tend to see or use on a regular basis?
I tend to go for a deadlift more.
Okay.
I like squats, but I go for a deadlift more because it's more, I find it's a little bit more practical because especially when people are like lifting something off the ground, it's usually done pretty poorly.
Yes.
Across the board.
Yeah.
And as soon as you just tell someone how to do it better, it improves right away. And they're like, it doesn't feel as heavy to pick it up, and it's not as awkward and uncomfortable.
Yeah.
So I really like a deadlift movement.
Okay.
So I tend to do that, and how I introduce them is in my carries. So
Okay.
that's how they set up. That's how they have to.
Okay,
pick up
right
the
on.
carries.
Good trans. Okay.
So that's how I introduce it, and then later on we may go to like a rack pull or whatever, depending on the range of motion.
Yes.
But they've done that movement already.
Okay.
They know how to pick it up properly.
Nice.
And then it's like now we just get to focus on that.
Yeah. And like in terms of how you view, like I guess, like programming and things like that. Like some people are all about doing, the classic rep schemes. Do you play around with a bit of endurance, work capacity, with obviously strength values, say in your clinic here as well?
Yep. I generally stay on the lower rep range.
Okay.
But not necessarily at the appropriate weight for that rep range, if that makes sense.
Yeah.
Where most people have been in a car accident, like there's tons of stuff going on. So, I mean, I think when I started out, everything was like, I'll do sets of 10 in my head.
Mm-hmm.
And then as I've, gotten more experience and work with more people, I often start with like, you know what, let's try for 5.
Okay.
And if they're like, okay, 5 is good, then we leave it there and, work up in terms of their reps.
Yeah.
And once we're getting to the 10, 12 range, we start just putting the weight up.
Putting the weight on, exactly. Okay.
Work harder that way.
Okay.
But I tend to stay on the lower rep range for most people.
That's good. Honestly, a good statement, to be honest with you, because no question, I think 3 of 10 is
like
the
classic,
universal, right?
Yeah.
Back from the 70s, really. And I think, if you're, yes, you may not be hurt per se, but if you have weaknesses, and this is where, like, when you do something generic, maybe it's classes or other things, is that people, yes, go to their comfort zones and they go to kind of what they know, but that's a good point, especially when we're talking about resistance training more than other forms of training that is not as demanding, is to kind of work your way in. It's not all about getting that pump. It's not all about, getting that...
DOMS. It's
right.
not all about
it's
being
no,
sore,
it is, right? That next day
know?
soreness, absolutely not, right? If you're looking at a progression and continual improvement in a fairly sometimes complex movement pattern for a lot of people that haven't been exercising before, I think that's just it. If you're doing things on your own, then break it in easy. Just at least get the fundamentals down, and then you can get into the fun stuff down the road.
For sure.
Right?
And I always tell people, like, technique trumps numbers any day.
Yes,
do you know what I mean? So I'm
absolutely.
like, I don't care if you can do 12 and half of them are crap,
Yep.
because that's how we get hurt.
Yep.
And that's how we stay hurt.
Yep.
So if you want to start
Keeps
with...
you busy.
Yeah, sure. In the wrong way.
I know. I know.
I'm not keeping them busy by hurting them, But yeah, keep it low, and you're like, okay, you can do 4 really well.
Yeah.
Let's stick with that. And then if next day you're like, even just one session sometimes is all it takes for someone to be like, oh yeah, I really got it now, because they've done it, they've heard me explain it, they've seen me show it to them. So it's kind of like all the learning styles too coming together.
Cool.
And so from there on, they're like, oh yeah, this weight doesn't feel so bad. I get it now.
It gives you that better feedback anyways, right?
So,
going forward. Okay.
Yeah, I like keeping it low.
Perfect. All right, well, that's it for this. And next video, though, we're going to get a little bit some demos in. And so please stay tuned. See you then.